Leonardo da Vinci once said, "The human foot is a masterpiece of engineering and a work of art." For most of us, our feet do really hard work and are an important part of our health and well-being, but we often take them for granted. Join us as we chat with Erica Kennedy, licensed practical nurse, foot care specialist, and founder of EK Feet.
Basically, for your overall health, it's important to take care of your feet.
Come, let's hear her advice.
Thank you for joining us from the belle ville de Montréal to talk about the importance of foot care and foot health.
You're welcome. Thank you for inviting me. I appreciate it.
Yes, and I think it's something that a lot of people take for granted, right?
Exactly, because our feet is very important. You know, I always listen to the song of Bob Marley. One part says, I can't remember the name of the song, our feet is our only carriage.
Yes.
So, you know, and sometimes we tend to neglect, we tend to take care of, we go from up and then we tend to neglect our feet. So it's important.
So true, so true. But before we dive in, I'd love for the viewers to learn a little bit more about you. So tell us a little bit about yourself.
So what I do for a living, I'm an LPN by profession. I've been doing this for the past 33 years. I work in a long-term care facility, mostly with clients who have Alzheimer's, dementia with behavioral issues. And for the last 13 years, I've been doing foot care, which I have my own business. My business, it's mobile. I'm still doing mobile, and I also work where I have a contract in a CHSLD, where I do the foot care for all the residents there.
And well, I know the importance of foot health, but please tell our viewers why is foot care and foot health so important to take care of our feet?
It's important to take care of our feet. Number one, for mobility. We need to walk around. And if we have problems with our feet, or if we're not taking care of our feet and we're walking, we could have like pain, discomfort, and also for independence. You know, if some people who have underlying issues such as diabetes or circulatory problems, if they don't take care of their feet, then they start to have more issues, which could even lead to amputation. So that takes also away from your independence. And basically, for your overall health, it's important to take care of your feet.
And most people are probably wondering what does a healthy feet look like? And for example, if someone has corns or bunions, can your feet still be healthy even with those things?
Of course, your feet can still be healthy if you take care of them. You need to, of course, wear the proper footwear. And what I would say a healthy feet look like is that your nails are trimmed properly. And also you're having if you do have problems with your feet, you should have regular follow-ups with a professional, which would be like a foot care nurse like myself or a podiatrist. Also, if you have dry skin, you know, you need to make sure you have healthy feet is also comes with good hygiene. So each daily taking care of your feet, that makes sure they're clean, make sure they're dry properly, especially I tell people, make sure you dry in between your toes, which a lot of people tend to forget because moisture and darkness, it breathes bacteria and it could cause fungal infection. Also, I would also say like the temperature of your feet is important. So if your feet are too cold, you probably have problems with circulation. If some parts of your feet tend to be warm, you could probably have, there could be an infection. For instance, if you're having ingrown toenails and it's warm to the touch, that could be a cause of infection.
And when you talk about proper foot care, so just going back to what you'd said earlier about the importance of proper foot care, what does that look like? And what does that constitute?
Okay, so proper foot care is that you need to have shoes that fits well, first of all, and especially if you have bunions or even hammer toes. You know, if your shoes aren't, sorry, if your shoes doesn't fit well then you're going to have more issues such as corns and calluses. I also recommend that you wear shoes that has natural fibers, such as leather shoes instead of synthetic shoes. Sometimes you may wear something that's synthetic and it's not breathable. And some people may have sweaty feet, so that, that could cause infection also. Footwear, I always recommend that you buy your shoes at the end of the day. The reason why is that you're walking all day and your feet is a little bit more swollen then, so then they fit better, much better.
And so we're going to also go back to, you were talking about the importance of cutting your nails properly.
Exactly.
And what does that look like? So because a lot of people, they do it themselves, right? They may not have the time to go to a professional to do it. So
Exactly.
they're quickly doing it themselves. So
Exactly.
what should they be doing What should they be doing?
So if you choose to cut your nails on your own, I would recommend that you get the proper tools. So I have professional tools, which is a nipper. You could buy some at the pharmacy. They're not as professional as mine, but you use a nipper, and also you should be cutting your nails straight across. Some people tend to be cutting at the sides. You cut them straight across. People who are diabetic or have circulatory problems, they should not be cutting their nails on their own. The reason is that if they get a cut or, a laceration, it could cause an infection. It could cause further issues. Also, people who are elderly, sometimes they have problems with their eyesight. Sometimes it's dexterity. Sometimes it's hard to bend for them. So those are other issues that why I would not recommend that they cut their nails on their own. They need a professional to do so.
And in terms of some of the key foot issues that you see, what are they?
So first, I spoke about corns, calluses, bunions, what we call hammer toes, where the bones are, implicated. Ingrown toenails are a big one, and also fungal nails. And I may add sweaty feet also, people that their feet perspire a lot. So those are some of the issues.
And so a lot of these issues, I'm assuming a lot of these are preventable, right?
Yes, they are.
And how do people prevent some of these issues?
Okay, so first of all, we could start with corns and calluses. So corns and calluses, they're basically caused by repeated movement, friction, and pressure, and also by tight fitting shoes. So if you're wearing shoes that are too tight, of course, you should try to wear shoes that are more loose fitting. As women, we tend to wear a lot of high heels and narrow pointed shoes. So that's also a factor. And fortunately, some people, it's heredity. So they tend to have feet that maybe the shape of their feet, and they have bunions, So sometimes they can't help it. They will be getting calluses. People that walk a lot, if you're an athlete, if you're working and you have to walk around all day, you tend to have corns and calluses. So you need to treat those. Like, for instance, I have a client and he looks very good for his age. He's about 84 years old. He still works. He works at a bakery. His feet are pretty good, with the exception that he gets calluses. So I see him every month religiously. And he will even call me when, like now it's summertime and he walks a lot. So I usually see him every 4 weeks. And now I may be seeing him every 3 weeks. So right. His feet, he has good, nice feet, good, healthy feet. But because he's walking a lot, repetitive movement, friction, he gets calluses, but it's treated. And if those calluses and corns are not treated, it could also lead to infection. And it can be very painful also when walking.
Because of the rubbing against the shoe.
Exactly. Because it's basically a buildup of dead skin, and it's your body really reacting to something that's not natural, basically protecting itself.
Right. Yes, exactly. And I think a lot of athletes see that as well, right?
A lot of athletes, yes. I have a son that plays basketball. He played basketball in high school, college, and university, and he had a lot of calluses on his feet.
And in a case like that, should athletes be coming to you on a regular basis to make sure that they take care of their feet?
Yes, they could either see a foot care nurse, come to me, or they could also go to a podiatrist. And also on their own too, you could do foot soaks with Epsom salt, sea salt, or some baking soda, or use a pumice stone. A pumice stone, it's natural. You use a pumice stone after a bath or after you soak your feet, or a foot file. For people who are diabetics, though, or with other foot issues like circulation, I would not recommend a pumice stone because it can be very abrasive, and they could really cut their skin, which could cause infection.
How often should one do something like that for someone who's doing it themselves?
The more you do it, your body reacts to it. So your body is saying that I need to protect itself. So I would recommend maybe every 2 to 3 days, depending on how much calluses you have. And also you have to be very gentle when you do it, not too vigorously.
When should people start paying attention to their feet?
I think people should always be paying attention to their feet, but mostly if you're diabetic. If you're diabetic, and I know I'm repeating myself, or if you have problems with circulation, if you see that you're starting to get calluses and corn, and usually people who are elderly, as we get older, our body changes. So does our feet. There's our muscles, our bones, fat distribution. So it's the same thing in your feet. And most of these corns and calluses, they're usually on your bony prominences, as we would say. So usually where there's bones, that's where you usually find them. So I think even if you have healthy feet, you should really pay attention to your feet. Moisturizing your feet is very important also, and as I'll go back to wearing good footwear is important. Wearing socks that are breathable is also important, and wearing socks with your shoes, because sometimes if you're prone to get corns and calluses, some people may tend not to wear socks with their shoes, and that could also be a problem because the bare skin now will be rubbing against the shoe or the material of the shoes.
And talking about socks and shoes, I'm going to ask you this question about socks and sandals. It's the middle of summer, and I see people in these socks and sandals, which I must admit is one of my pet peeves. So
it used to be my pet peeve. I do it sometimes. It used to be my pet peeves. I don't know. I guess it's some form of comfort. I think it's up to the individual. If your feet are very dry and you need to moisturize them, you could do it for a time, but not to be wearing all day. And I think it's important also in the summer. What I usually tell some of my clients to do is to let your feet breathe. Let it breathe. Especially people who have fungal nails also. I mean, aesthetically, it's not the nicest, but sometimes you need to let it breathe, because if you cover it with the socks also, it's dark, it's become dark, so bacteria will breathe. But I think for the socks and sandals, I know a lot of people, they wear what you call the slides, especially athletes and stuff like that. I recommend, if you really have to wear those, to wear them with cotton socks. The reason being because it's not a natural material, it's plastic. So you're barefoot against that, it causes a lot of calluses. So sometimes if I see a client and I'll see the calluses, I could tell that they're wearing those rubber shoes. So sometimes the socks and those sandals are not so bad.
Yes, because it prevents blisters, I'm assuming, right?
Exactly. And if you're diabetic too, you have to be careful when you walk outside with, you could get an injury. And because also poor sensation, you may get an injury and you may not even know.
Are there certain things that people need to be thinking about as they age, right? In terms of caring for the feet?
Of course. So as you age, as I mentioned before, dexterity, poor eyesight, you're unable to bend, and sometimes your nails, they change. You have some people get very thick nails. They get thick, your nails become very thick at some point and very hard. So it's difficult for them to cut also. So those are the things they have to think about. Your skin also becomes to be more dry. So you need to have moisturizer. Unfortunately, some of my clients, they're unable to bend. So sometimes they tend to have very dry skin. So that's also difficult if they don't have a caregiver, or if they don't have someone at home, if they don't have a spouse. If they do have a spouse, I try to, encourage them. Listen, put some moisturizer on your wife, and, vice versa. So those are the things they have to worry about. And also, as we get older too, some people might become diabetics, so they have to be careful with their feet. I always tell people, try not to go to the spa or to the mall to get your feet done, because these people, they're not professionals. And if you get a cut, or sometimes they cut the nail, and you have to be careful, because if you don't cut the nail straight across, you may leave just a little piece of nail on the side. And when the nail starts to grow back, that's when you start having ingrown toenails. So you have to be careful. If they're not knowledgeable about, people who are diabetics, they just cut your nails and you could have an injury. It could lead to amputation, which I have seen in the past. So that's all.
Prevention is key as well.
Exactly. And also the footwear. As we get older, our gait also is compromised. So you need to have good shoes with good grip, to prevent falls also. That's also another factor.
But also, should somebody who's a bit younger, should they also be looking into taking care of their feet? Because someone that may be younger saying, you know what, I'm young, why do I need to take care of their, their feet or my feet?
Of course. And it goes back to proper footwear also. So you have proper footwear, good hygiene, because if you're young and your shoes and young people also, they have corns and calluses, and a lot of them have ingrown toenails. So just because you're young and you're going to wear shoes that are tight, and then by the time you get old, your feet are totally messed up.
Yes, so start early, taking care of your feet. And do you see a difference between men and women in terms of foot health, foot care?
Men have better feet.
Really? Oh, because of the heel. Yes, because we wear so many heels,
I tend to
right?
think that, well, I think men have better feet. And I used to take care of a lot of veterans. Most of them have passed on now, but they used to have feet that are really immaculate. I don't know why. So as women, we like the high heels. I spoke about the narrow shoes before. So we tend to get the corns, the calluses, the hammer toes, and you even have sometimes toes that we call it overlaps. If you can see my, Yeah. So, and then on the other hand, women tend to go to the spa to they tend to take care of their health in general more than men, so that's another factor. Men can be so stubborn, and I'll tell you a story. I will have a client, like a female with a spouse, and I'll be doing her feet, and then she'll be saying to her husband, get your feet done. And sometimes they're like, no, it's okay. Till eventually, by the time I get to do his feet, the nails are long. They're totally, it's amazing. So men from my experience, I feel that men do have better feet than women.
How do we ensure that we have healthy feet at all ages?
Good foot hygiene, wearing the proper shoes. And as soon as you have something with problems with your feet, if it's pain, any kind of discomfort, you need to be very proactive. See a foot care specialist, and also not to see them once. You have to continue with the treatment. You have to be very proactive with the treatment. Use lotions. Even sometimes I take my shower when I'm rushing, and by the time I get in the car, oh my God, my feet are really dry. So moisturize your feet. It's very important. When your feet are very dry, even when you're wearing the shoes, it causes also the friction. You could start getting little cuts, So that's important. If you're diabetics, and I speak a lot about that, they really need to take good care of their feet, take care of their skin. So It's important all the time. And when you're walking and if you have pain and discomfort, it's not a very nice thing. As you get older, you're very independent. You're used to going to do your shopping. You're used to going for a walk. And then all of a sudden you're having a lot of pain. Your shoes are tight, or you're not wearing the proper shoes. And I mean, we can never tell ladies not to wear high heels. So what I say, if you need to wear your high heels to a function, bring a flat shoes or running shoes that you can give yourself a break.
Or are there certain types of high heels, like maybe platforms? Are the platforms
are better? And then you have brands like Neutralizer or Clark's. They tend to have comfortable shoes. And not because it's a high-end brand too, they're comfortable. Because I've bought high-end brands and they're not so comfortable. They're cute, but not so comfortable. So, and I wanted to add to some of the products that I use, which I think are very good, especially for moisturizing. So shea butter, that's an excellent product. I love to use shea butter. People who have very dry skin, they may use creams that has some urea. Sometimes it's 20%. Sometimes you may need a prescription for that. Tea tree oil if you have fungal nails, and castor oils is very important too. Even if you don't have fungal nails, you can use the castor oil as a moisturizer, as moisturizing your nails. Epsom salt, sea salt soaks, baking soda soaks is very important also. Wearing socks, as I mentioned before, that are cotton socks, they're breathable. I also tell my diabetics to wear white diabetic socks. The reason being is if you have an injury, especially if you live alone, you may not feel it because you have poor sensation or no sensation at all. So once you remove your socks, you could see if there's any blood or there's any injury.
No, this is all really important information, Erica. Thank you very much. So tell our viewers, how do people get in touch with you? Because from my perspective, I think everybody should have either a podiatrist or someone like a nurse like yourself that specializes in foot care. So how do people get in touch with you?
Right now, people get in touch with me, it's always word of mouth, to tell you the truth. I never advertise. So once I have a client and they're happy with my work, they usually tell their friends or their families. But people can get in touch with me through my phone number. So it's 514-865-3987, or by email, it's ekfeet1@gmail.com.
Thank you. Thank you very much. Yeah. And so they can reach out to you to schedule an appointment.
Exactly.
Perfect. Thank you very much. So really important, viewers, take care of your feet because you want to keep walking for a really long time.
Very long time.
Walking very long, pain-free, and comfortable. Thank you all for joining us.
Let's take time for moving.
Take care of your feet so they can take care of you. Remember to like, comment, share, and subscribe. Thanks for tuning in.